TAVR, or transcatheter aortic valve replacement, is a minimally invasive procedure performed at Salina Regional Health Center in patients with severe symptomatic aortic stenosis.
In fact, we've actually just completed our 200th TAVR. I'm Angie Bogart, nurse practitioner for the Heart Center at Salina Regional Health Center.
And I'm Dr. David Battin, an interventional and structural cardiologist for the Heart Center at Salina Regional Health Center.
Well, Angie and Dr. Battin, thank you so much for coming on the show. We're going to be talking about the TAVR, which is a procedure you've been doing at Salina Regional Health Center and the Heart Center. In fact, you've done 200 of them. Why don't you explain what the TAVR is?
Yeah, thanks for having us. We've recently accomplished our 200th procedure, so roughly we've been doing it about 4.5 years now. So TAVR stands for transcatheter aortic valve replacement, but it's a minimally invasive procedure that we do to replace the aortic valve, which optimizes patients' ability to get out of the hospital much quicker.
So what are the advantages between the TAVR and the previous valve replacements?
Yeah, the largest advantage is how soon someone is able to get out of the hospital. If you can imagine, a surgical aortic valve replacement where you're placed under general anesthesia and an incision is made along the breastplate, and the heart is stopped and placed on the heart-lung machine. You end up staying in the hospital anywhere from 5 to 10 days, about half that time in the intensive care unit. Take that versus the minimally invasive. We are generally able to do it through the legs, through the arteries in the legs, which translates to a hospital stay of usually 1 day.
Angie, why don't you take us through the process from diagnosis to seeing Dr. Battin?
Yes, once you're diagnosed, you'll be referred to the valve clinic. At the valve clinic, we'll call you, we'll visit, review all the tests you've had up to that point. We'll discuss further testing that you'll need. There are several tests we need before we can make a decision whether you're a candidate for the TAVR or open valve surgery. Once those tests are completed, you'll come see us in the clinic. You'll be evaluated in a multidisciplinary fashion by myself, Dr. Battin, and Dr. Kentos. We'll review all of your studies and we'll develop a plan. Once the plan is developed and we decide a TAVR is what's best for you, for your intervention, you'll undergo the procedure, typically out of the hospital within 1 to 2 days. Post-recovery, you'll come and see us in the office the first week, and then you'll proceed to recovery with cardiac rehab. Most people are feeling better within the first 1 to 2 days of the TAVR procedure.
Well, thank you so much for being on the show, and thank you for watching. For more information, you may visit the Heart Center page of srhc.com, like us on Facebook, follow us on X and Instagram.